Dr. Shah, here we are at the American Heart Association Scientific Sessions. Coming into this event, what were you looking forward to learning about?
I'm a cardiologist, I see patients, and my world involves the intersection of that patient care with data. And there's so much more data coming in the data stream for electronic health records, genetics, mobiles, wearables, everything. The issue is we don't know how to use that data. So in the last few years, there's been a lot more interest in this from industry side, academia side, and I think those two worlds are coming together a bit more, especially including the clinicians, because we have a whole domain to learn in order to be a part of this process by which medicine is changing.
Tell me how you're seeing all those things come together.
In a lot of ways. I mean, the American Heart Association itself has gotten into this game. They have a whole funding portfolio about data science and artificial intelligence and these sorts of precision medicine tools. That's one side. And then the NIH similarly has initiatives where they're focusing on funding research about this.
So one of the big kind of complaints, I would say, is that initially people started collecting all this data and it seemed very alluring. Now it's been kind of looked at as kind of overkill or too much. So how do you respond to that?
My latest punchline is we don't need more data, we need the right data. So I think the system by which we can collect data through the electronic health record, that sort of infrastructure is there. We're going to modify it, we're going to update it. But what are the right data elements? So for example, I think earlier in the EHR adoptions, we weren't talking about social determinants of health, right? You might have written that in your note, 55-year-old homeless male, right? But we weren't collecting that data systematically. And now companies are starting to make that systematic, standardized data collection. So that's an example of, it's not about more data, it's about the right data. And those are the things that matter.
In your cases, professionally, in your own experience, is there a piece of data that you found especially valuable in the past 5 years that you wouldn't have expected coming out of medical school?
Where I practice, University of Utah, we have an interesting rural community. So we get cases that are getting flown in from Nevada, Wyoming, Idaho, and there's a lot of features about those patients that I had never seen before.
Wow.
Right? So like, where do they live? Is there a pharmacy that can provide the drugs I think I need to prescribe here? How delayed was their care? And those are things about patients that I had never thought of until I was in Utah. And I think we need creative solutions to make sure we're addressing the needs of those populations in addition to the patients who have been in these trials for decades.
The other trend that's kind of coming out that I'm speaking to people at this table is really talking about kind of the holistic behavioral side. So how does that play in for you, not only as a cardiologist, but also in light of the community you just spoke about, a rural community, maybe one that isn't as access to care?
Yeah, I am cautious about believing that technology is going to solve those problems. It's an app or telehealth is not going to solve the problem of somebody not having access to healthy food, or having money to buy healthy food, or having money to pay for their drugs, right? Technology is not going to solve those problems. Those are much larger societal structural problems that, the problem, you need the right solution for the right problem, right? You need to match those well. And I'm not sure technology is the right answer for those things.
And are you able to see anything in some of these sessions or whatever that may be pointing to a better answer?
We had a great debate this morning about insurance reimbursement and what's a good strategy, or Medicare for all, or keep the private market. And I think there are some interesting points on both sides of that equation. And the AHA is always it's part of their mission to promote equity in healthcare delivery and cardiovascular health. So there's always a lot at the sessions about these topics.
It sounds like that's part of your mission too.
Oh yeah.
So what do you hope in let's say the next 5 years, if you were coming to this exact same event, what would be the most exciting thing that you think might be possible to see?
In terms of this sort of technology, artificial intelligence, EHRs, we see a lot about development. We're going to make this prediction model and has these performance characteristics. But what I would love to see is we're not talking about that anymore. We're talking about the problem. So we had this problem, patients, we didn't know which patients with heart attacks were going to die, let's say, some example. And we're not talking about the technology to solve it, but we're actually talking about the solution and how that impacted somebody. So I don't think that we've really moved into direct evidence of helping patients with all this technology just yet. So in 5 years, that's where we got to be.
Anything else you want to add? That was great.
We got to support the younger generation and get people up through the ranks. This is not about billing. It's not about patient volume. It's about learning the skills to actually change something.